Cast is now starting. All attendees are in listen-only mode.
Hello, this is Asaf Glosser at MEF Associates. I'm pleased to welcome all of you to Domestic Violence During COVID-19, Voices from the Field. Thank you all for joining us for the second session of the 2020 NAWRS virtual series. NAWRS, the National Association for Welfare Research and Statistics, holds in-person conferences every other year where human service researchers, practitioners, and policymakers come together to talk about their work and how it can inform policy and practice. Several years ago, NAWRS began holding virtual webinars in years when the conference wasn't occurring. These events represent an opportunity to keep the NAWRS community engaged and to highlight interesting research and trends relevant to our membership. This year's virtual series occurs as our country faces unprecedented challenges associated with COVID-19. The pandemic is affecting us all personally and professionally. Many are worried about the health of loved ones, job stability, and the challenges the pandemic and stay-at-home orders pose for us and our communities. Here at NAWRS, we're trying to find ways to support our membership and quickly share information on how human service programs can respond to the changing circumstances on the ground. Today, we're fortunate to have a diverse group of panelists working at the national, state, and local levels whose work focuses on supporting the needs of families at risk of or experiencing domestic violence. Even under normal circumstances, there's much progress to be made in how human service programs help these families, and the need is even more acute these days. Before I turn over the panel to our moderator, Michael Hayes from the Administration for Children and Families, I want to plug a few additional upcoming events in the virtual series. We will soon be announcing additional events in the series taking place as the summer goes on. These panels are going to focus on issues like machine learning, the Family First Prevention Services Act, and cross-system collaboration to serve justice-involved clients. Keep an eye out on the NAWRS Twitter feed, @NAWRS Workshop, and our website, nawrs.org, for more information. We're also recording this webinar and we'll post it to the NAWRS website in the days to come. I also want to extend appreciation to several folks who made this panel possible. I want to thank Manhattan Strategy Group for sponsoring this session. You can learn more about MSG and the work they do at manhattanstrategy.com. In particular, longtime NAWRS board member Mary Roberto at MSG has been integral in supporting this session and last week's session on how TANF agencies are responding to the pandemic. Today's panel would also not have been possible without Jordan Engel here at MEF Associates and Lauren Antello, my co-chair on the virtual workshop at the Administration for Children and Families. Both were instrumental in making this event come together. And finally, a particular thanks to our panelists. They've been giving with their time leading up to this event, and I'm looking forward to the discussion. With that, I'll turn things over to Michael.
Thanks, Asaf. And I'm just going to do a quick audio check. If you'll tell me if this sounds good, Asaf, to you. Good volume? Okay, great. So very happy to be here. As Asaf said, I work in the Administration for Children and Families in the Office of Child Support Enforcement. And I have with me today 4 really wonderful speakers who I think of as, smart, compassionate, genuine, and grounded, and also who have a real finger on the pulse of what's happening in the field. Our panelists include Rachel Orsinger. She is a senior family violence prevention specialist in the Division of Family Violence Prevention and Services. That's within the Family Youth Services Bureau at ACF, so a colleague of mine within ACF. Excuse me. Miriam Durrani, who is the Director of Policy at the National Resource Center on Domestic Violence, who has a long history in advocacy, legal work, policy work within the domestic violence field. And I'm not going to go into background on people's bios. I'm going to ask them to share whatever they think is most relevant for today's presentation as we go through and people talk. Then we also have Samantha Hinchy, and she is a DV program coordinator at the Arizona Coalition to End Sexual and Domestic Violence. And finally, we have Amanda Vasquez, who is the Division Chief of Program Innovation, and that's in the Texas Attorney General's Office, the Child Support Division there. And so I want to give just a little bit of an overview of the genesis for this, this little webinar series or webinar that we're putting on today. It really started with Asaf and I talking about some of the work that the Federal Office of Child Support Enforcement has been doing with state child support programs on training, policy, and procedures work related to domestic violence. And that has been informed by FIPSA, Rachel and her team, and Miriam and her team, and Samantha and Amanda have both been involved in that in different ways over the years. But it's an example, and we thought it was a really great example of how there was this kind of breaking down of silos between a major public services institution, the child support program, that has a very clear sense about what its purposes are and what its goals are and performance measures are, and breaking silos, that silo down between child support and domestic violence service providers, state coalitions, and as well as the local programs. And there have been a few kind of big themes that have come out of that work over the last 3 or 4 years. And one of those was that while the connection was obvious once the connection was made, nobody was thinking about it. Kind of, it oftentimes been overlooked. That there was a limited connection between the child support program and some of that safety net that it could provide and the work that was happening with practitioners in domestic violence service providers, domestic violence prevention programs in the community level. There was enthusiastic response once the connections were made, a lot of co-training happening between child support agencies and their staff and domestic violence programs, a lot of policy and procedural collaboration, public education materials and outreach that were being done together. And so we really saw this as a great success when it came to a human services program, child support enforcement, which also can be seen as a justice program, and domestic violence. And so then we were talking about that before really the pandemic hit, doing a session just kind of more generally about what child support and domestic violence had been doing. And then with the onset of the pandemic, we really had this kind of conversation. It's like, what are the opportunities to highlight response around COVID-19? And one comment that came to me at the Federal Office of Child Support from a state child support worker was about the fact that they were moving to, transitioning to remote delivery of services. They've been also reading about the increased risk of violence to survivors of domestic violence because of the stay-at-home or the shelter-at-home orders. And they were wondering, kind of as a state child support agency, could they be doing something different as they were having routine phone calls with parents and doing more screening and offering of safety as part of that. And I just loved that kind of creativity in the face of this, the kind of the overwhelming demands on public agencies having to transition to remote service delivery. And after talking with the SOF about it and with our panelists, we thought that this is one place that we could share some kind of developing, like, real-time work on safety and economic security to survivors. And so that's the background on today's webinar. So with that said, I want to turn it over first to Rachel to give a little bit of background about what's happening within the Family Violence Prevention Services Program. She'll give a little bit of background there, kind of what they're doing, and then pass it on to Miriam to talk a little bit about what the National Resource Center on Domestic Violence is doing, and the kind of requests they're getting. And then we're going to really dig in. I've got a set of questions to ask our panelists about the kind of practical stuff that's happening in the field, and want to encourage you on the line to be thinking about questions you'd like to ask as well. And go ahead and ask those in the question box, and I'll try to track those and manage that as we go through the call. So with that, I'm going to pass it to you, Rachel.
Thanks, Michael. I'm Rachel Orsinger. I'm from the Family Violence Division of the Family Youth Services Bureau, as Michael said. And we really just appreciate all of this collaboration with the Office of Child Support Enforcement and with Michael in particular, who's just a wonderful partner in this work around domestic violence. The FIPSA Act, as we call it, the Family Violence Prevention and Services Act, is one of the first sets of federal government funding for domestic violence in the U.S. We fund grants to the states, tribes, and domestic violence coalitions. About 1,800 domestic violence programs across the country receive FIPSA funding. And we also fund over 250 federally recognized tribes for domestic violence services and prevention. In addition, we also are really lucky to have a number of technical resource centers that provide technical assistance to both our grantees and anyone in the field working with survivors of domestic violence and survivors themselves on a host of different issues. So we have the National Resource Center on Domestic Violence and the National Hotline, Domestic Violence Hotline, but we also have a bunch of special issue resource centers that look at very particular issues like about child custody or the health system. And so right now, our office is very focused on hearing from the field how domestic violence survivors are being impacted by this crisis in all sorts of ways and all the other systems that they have to touch, because we know that domestic violence really impacts how people interface with any sort of system. So all of the different ways that this is hitting people are really important for us to find out about, and then we're focusing on how to try to make it easier for the local programs to get the services to the people who need them in ways that work with the current restrictions. I'm sure you'll hear more from Miriam in just a moment on that.
Okay. Thanks so much, Rachel. And Miriam, Rachel talked about you as one of the national resource centers. So why don't you tell a little bit about what the work that you're doing and what you're hearing also from the field, and maybe also if you would touch upon a little bit of the funding that was part of the CARES Act that's related to domestic violence, that would be helpful too. So thank you.
Absolutely. Thanks, Michael. So I'm Miriam Durrani. I'm the Director of Policy at the National Resource Center on Domestic Violence. We have been around since 1993 with, as Rachel mentioned, funding from the Department of Health and Human Services. We are a resource center, so we have a variety of different projects and websites. I just wanted to flag for you, if you ever have a question on domestic violence, if you're like, I'm looking for a resource, I don't understand how to deal with this client, I'm looking for a thing. If you go to our website, nrcdv.org, and go up to the TA box, we can probably get the answer to you or find someone that can. So just wanted to go ahead and plug that. So in terms of the National Resource Center's activities around the pandemic, we have been really trying to educate folks on the unique needs of survivors when it comes to the crisis. We are primarily dealing with calls and emails and technical assistance requests that are focused on survivors who are, of course, quarantined or forced to quarantine with an abusive partner, survivors who are fleeing or attempting to flee right now, and then survivors, of course, who are already in a domestic violence shelter or in communal shelter. So those are a variety of different needs. Of course, safety planning being one of the most emergency and startling and alarming need. So I've also sent our fantastic organizers a giant list of resources that touch on the court systems, that touch on the housing systems, that touch on safety planning when survivors are staying with an abuser. So I'm sure the organizers will get that information out to you. So I'm really hoping that you find something that you need and something that can assist you. In terms of our broader advocacy, something that we have been doing is educating administration officials and federal agencies and, of course, members of Congress on these unique needs that survivors are facing and advocating for those unique needs to be included in legislation. So one really positive development that did happen was the inclusion of some additional FIPSA funding in the CARES Act. So as Rachel mentioned, FIPSA funds those domestic violence shelters and programs across the country. People don't always know about FIPSA's existence. And it's amazing but critical work. So the CARES Act did include an additional allocation of $45 million to domestic violence programs around the country. So the FIPSA office will be working on administering that funding across the field, and that's to state domestic violence programs, to domestic violence coalitions, and to tribes that are working across the country. And that also included a little bit of money, $2 million for the domestic violence hotline, and that's another resource that I want to flag for you. They are amazing at safety planning. They're open 24/7, and they have transitioned all of their services to virtual. So that is a great resource if you are talking to someone or need a resource to send to someone about, some basic what to do if you or someone you know are facing domestic violence. The National Resource Center, or the National Domestic Violence Hotline, is a fantastic resource as well. There is also a variety of different housing funding, if that is an area that you work in terms of emergency funding. We do have an entire website called safehousingpartnerships.org that addresses the connection between domestic violence, housing instability, and homelessness with survivors. So if you have any questions on that in particular, you can visit us there. And there was additional $50 million included for a Legal Services Corporation, which is of course going to be leveraged in a variety of different ways across the country. So many different funding streams. Of course, we'll continue to advocate for what survivors need and really hope that those needs are taken seriously in future pieces of legislation. But lots of fantastic resources available already, lots of really creative solutions as programs around the country grapple with how to best serve survivors. And hopefully, if you have any particular questions on how to serve survivors or get their needs met, feel free to reach out to us always.
Great, thank you, Miriam. So I've had a couple questions already that I want to just, that you can respond to, I think, really quickly.
Sure.
There were there were several people asking about your website, if you'd repeat that, and then also the website for the safe housing.
Sure. So our website is nrcdv.org, and so the National Resource Center on Domestic Violence, so nrcdv.org. So up at the very top of that website, you'll see a little chat icon. It will pre-populate an email form for you, so you can email any questions you have there. As Rachel mentioned, we're not the only resource center. We're part of this rich learning community called the Domestic Violence Resource Network. So a variety of different TA centers that we can connect you with and refer you to if you have a very specific need or issue. The other website is safehousingpartnerships.org. So that's safehousingpartnerships.org. And there's another question bubble up top that says technical assistance. If you have any questions in particular about the connection between domestic violence survivors, housing instability, housing insecurity, and homelessness, that's a great place to go. That collaboration of folks is also doing weekly webinars right now. So if you are grappling with issues dealing with housing in particular, that's a great place to go. And the website has lots of fantastic information that should be able to help you always, and then now in particular as well.
Great, thank you.
Sure.
Okay, so we're gonna move to asking some specific questions of Samantha and Amanda, but also Miriam and Rachel. I want you to chime in. While this conversation will be heavily focused on child support, since that's where I'm based and also where Amanda is, and then Samantha has been working very closely with the Arizona Child Support Program from the Coalition's perspective. We're going to also talk kind of more broadly about the the kind of social safety net in those human services programs. But since this is an association that focuses on research, I did want to just mention the fact that one area where there is not much research at all, in fact, is on child support and domestic violence. A little bit of research has been done by Cynthia Osborne at the University of Texas, and one of the things that came out of that research was, and that did surprise some people at least, maybe didn't surprise everyone who's been working in the field, was that it looks like about 4 out of 10, not quite 4 out of 10 custodial parents who have a child support case report having experienced domestic violence with the other parent in that child support case. It's basically sometime within the first 3 years of their child's life. And so while we have a little bit of information on the incidence of domestic violence, we don't have a whole lot of other research related to interventions or best practices. And so some of this is going to be based upon the experience just from the field. So let's go to the question. And so the first question that I'd like for Samantha, you and Amanda to talk a little about is kind of what are you and your colleagues, so Amanda, your colleagues, especially in the domestic violence advocacy program world at the state there, and then Amanda, your perspective on this from child support caseworkers. What are you hearing about the impact of COVID-19, the precautions, the shelter at home, the quarantine? How's that impacting individuals and families who are experiencing or at risk of domestic violence? And one question that was posed in our question box was also thinking about this in particular within communities of color. If there are any specific kind of variations that you're seeing there. So maybe Samantha, if you'd start off, and then Amanda.
Sure. Just a couple of the things that we've been noticing, we've been trying to have conversations with all of our programs on a voluntary basis every week since this has started happening, because we don't want to force people to do another webinar, but it's been a safe place for them to come and talk. And so just some of the things that we've been hearing is that there will be a week or so with nothing going on, and then like sexual assaults and domestic violence will spike in a certain area. That we've heard from several of the programs across the state that the violence is becoming more abusive, or more like deadly. Hold on, I'm just looking for a note that I wrote down. Yeah, so just it's becoming the spikes are becoming, like, the violence is just becoming more brutal for people that are being quarantined with their perpetrator. One of the things that's been really working out well for the programs has been, as we've moved into this like technological area, has been being able to do support groups online and trying to figure that out and do technical assistance on how to help the programs do some of the support groups they were doing before online, so that there's still a connection to their advocate if possible. And so that's been a really nice thing that's been going on for some survivors. It's just been really hard to get outreach, I would say, has been one of the hardest things. The calls on our helpline, like, so for our state helpline, and then also for just programs in general, their hotlines have been really slow. And so it's been really slow, and the majority of those phone calls have been about orders of protection and divorce. And so that's been really interesting to hear, kind of like the change in like what's being asked for. And it's been, we not only has, like, for here in Arizona, not only has it been hard for, like, there's a lot of questions around orders of protection, because we just moved on January 1st of 2020. We just moved to doing all of our orders of protection online. And so that's been a really different protocol for most folks, and they still want to work with an advocate in person to get those done. And so that's been really difficult for some of our mobile advocates around the state to have to do everything virtually with them to walk them through that process. So that's been kind of a hard thing that's been going on. But yeah, I would say just like a lot of outreach is being done in very unique ways. You know, just like we've seen some of the articles that have come out, going to grocery stores and having conversations with them and making sure that there's stuff either in there that we can partner with them, or at least at the very least being on like a board or something like that, a bulletin board in the grocery store or the convenience store. We're down to one courthouse, so that's been really interesting. They're doing a lot of stuff virtually, and I'm assuming that that's happening kind of across the country. Is that, like, they're doing a lot of the work, like judges are doing a lot of work virtually. We're down to one courthouse for child support cases and things like that here in Arizona, here in Maricopa County. So that's been really interesting to hear people talk about what that experience has been like, and that it's hard to have, like, advocates are not allowed to go, you know, depending on where their program is, they're not allowed to go to court with their survivor, and they're not, you know, and same for getting a sexual assault exam, like they're not allowed, some of them are not allowed to go into the exam room with their survivor. And so it's kind of, I think that our advocates are amazing at pivoting to figure out, like, what can we do to support the survivor that needs it right now, since the acts have been so much more brutal in certain areas. So that's just a few of the things we've been noticing.
Great, thanks, Samantha. You know, there was one question that came up here, and I think it'll also feed into maybe what Amanda's going to talk about. But it's like, so how do victims and survivors connect virtually with resources if the perpetrators living with them. You talked about that a little bit. I like that point you made about you're going to grocery stores and trying to get that information out. But there are other examples that you've heard of, the follow-up question somebody had to that was, have public service announcements been used as an outreach that you during this period that you know of?
Yeah, so for me, I think virtually it's been really difficult, because if you do have someone that's monitoring your stuff, that's been that has access to all of your codes and all of your passwords and access to your phone, I think for those folks it's just been really difficult, and they've been just working on trying to get out as much as they can, if possible, from their perpetrator. That's not always possible for everyone. And I think that technologically that's been one of the most difficult parts, working with some of the survivors, is that it's just hard for them to get to their advocate, or it's hard for them to get the resources that they need. So we've just been really working on trying to find, we made an entire toolkit on creative outreach for our, which we can send out to everybody so that people have ideas on how they can reach out. And so the advocates are out in the community still, but being as safe as possible, but letting people know that they're still here and they're still open. It's been really difficult even for shelter. Like, one of the biggest needs is hotel rooms for shelter, because they're trying to space people out. Instead of having 3 families in a room, they're having to have 1 family in a room, and then, you know, hopefully they have enough funding to put people up in hotels if that hotel is able to do that. So it's been difficult.
Okay. Yeah. So Amanda, you can talk about this a little bit from not the advocacy perspective, but from the the public human services program and a part of that safety net. What are you seeing? What are you hearing in terms of the impacts on victims? And we can't hear you.
I'm muted. Hi, everybody. Yeah, I appreciate the opportunity to be here today. I'm humbled to be a part of the discussion. And in Texas, being a really large child support agency, you can imagine that our call volume during this time and the amount of customer outreach there has been to our organization has grown exponentially, knowing that families are contending with economic constraints and turning to economic resources that maybe they haven't before. And so from our perspective, what's really critical is making sure that we don't take for granted our customer engagement opportunities, and making assumptions that someone who is interacting with us does not have a family violence dynamic occurring, whether that's been existing and they're turning to our services for the first time, or that they've been a current customer and didn't have a prevalence of violence in that relationship prior to this pandemic. But also for those that also have known family violence concerns on their case, that we are handling that with caution and being very thorough in the way that we address them in a virtual arena. We've made some policy changes that we're not going to be doing CSRPs, child support review processes, or newly established cases in which the applicants have indicated that there is family violence concerns. And so we're taking precautions like that. We're also trying to leverage technology to our advantage, so that if it is safe for the customer to engage with us electronically by means of email, there's opportunities for things to be signed electronically through DocuSign, looking at strategies to leverage those technological resources when we can. You can imagine for our state, having as many counties as there are, the court process has been varied across the state based on judicial discretion, and making sure that we are in constant communication with advocacy groups when a need is immediately identified, especially for our call center staff and so forth. So we look at as much as we can, but the one thing that I have been stressing to our organization is that we're dealing with three very sacred things for our customers. We're dealing with their children, their health and safety, and their access to financial resources. And we have to be good stewards of our process, ensuring that they can do so safely, while also reducing administrative barriers to do so safely. And so our partners at Texas Council on Family Violence have been very great. Right now, we're working with them to do a statewide webinar for our customer support staff, and also hopefully for maybe get some judges on board to view that webinar as well. But from their lens, some of the considerations that we're hearing from them that they want us to take is that if we're engaging with our customers virtually through a video opportunity, much like what we're doing, like through Zoom, that there isn't background cues on the survivor's location in which could be accessed by their perpetrator, and also handling as much as we can on an individual basis and not a joint interaction between the perpetrator and the survivor. And as much as we can separate that out, the best through our negotiation process.
You started kind of answering my next question, and it also responds to some of the questions that have been chatted into the question box, and that is you both, Samantha, you and Amanda both have done this, and I'm going to ask Amanda for you to go first, but that next question, and Asaf, if you can move to question number 2 on the slide deck, is that in what ways do you see the pandemic affecting how individuals, families impacted by domestic violence are interacting with social safety net programs, with advocacy programs and justice system resources? And pardon me, you talked a little bit, Amanda, about some of the policy changes that you were making, about reducing administrative burden. And so a related question that came in was, and this goes to Samantha, you as well, and that is our advocates not allowed to go to court with survivors because of COVID? And then are you seeing, and so I know historically in Texas, you've had DV advocates go to court with survivors on child support cases too, not just on protective order cases. So you've had that kind of thing. Sounds like that has changed some. And then the related question to that is, are you seeing a spike in, the question is, are you seeing a spike generated by stimulus money expectations? And I think this is an interesting one for a child support person to talk about a little bit, because you could have a victim who is in the home with a batterer. They might have a child support case with another parent, but they're in a home with a batterer, and the batterer is wanting to get that stimulus payment that is going to be intercepted potentially by child support. And so can you talk a little about that?
I'm just going to leave my mic unmuted, if that's okay, so there's not a delay. So we, I'm glad this question came up. It actually came up during our call with DCFV last week about advocates being able to go to court with the customers. Our core processes are concerning family violence are taking the normal policy route. However, for those that haven't expressed interest in that, those conversations should be happening, where if they want someone to attend. Now, I can't speak. I actually watched a family violence docket last week, and at that time it was just the judge and the affected parties and the attorneys in place. Now, what they did, this as their first go, was to have the community resource organizations, to include the local program, to be in a separate room, a Zoom room, to where they were then connected thereafter of the hearing. Pretty cool, right? And so we're learning more about that. I'd actually have a debrief with them scheduled for tomorrow. All that to say is that this is a very fluid situation in which we're learning about with each iteration of service delivery. And so specific to, so hopefully that addresses the advocate piece of it in some way, but also with the stimulus portion about kind of the access to financial resources at home. I don't know what the prevalence data is on that, but what I can tell you is that the inquiries on stimulus, when they're going to get it, how much is going to be intercepted, is generating a lot of the call volume and volume that we're seeing through live chat. I have a hard prevalence number to point to on that. All I can assume at this point, based on those dynamics, that is something very real for folks in that situation.
And Samantha, can you talk a little about the restriction on advocates accompanying survivors to court hearings?
Yeah, so basically what we've been hearing from advocates is that and I would probably have to check with Joe Nell specifically here in Arizona just to see if they're still having advocates go for some reason. But for most part, it's per their program. So some programs are like, and especially in the rural areas, some programs are very much like, yes, you can go to court with them because, you know, like their safety is important and we want to make sure that we're staying, you know, connected to our survivors. And sometimes they get like, and some of the programs are putting people in full PPE gear before they go anywhere. Some of the programs more in like the city, like in Maricopa County, are kind of keeping them like, unless it's an emergency, you are not to go to court, you're not to meet with your survivor, you're not to go to any sexual assault exams, anything like that. So that's kind of what we've been seeing as far as advocates doing things. A lot of our mobile advocates are chomping at the bit to get out and talk with their survivors. It's been very difficult for them. They've been doing just a ton of safety planning, like Miriam said, just a lot, like just there's so much safety planning that needs to be done right now around divorce and orders of protection and like what happens after this. So that's a big focus for them right now. As far as the stimulus, I don't have any comment on that.
So actually, I want to, Miriam, I want to come to you with this, and that is, you know, Samantha talked a little about what they're seeing in Arizona around advocates and contact with survivors, and can you give us a little national picture? Kind of what have you been hearing from organizations that you provide resources to and support to?
Yeah, of course. Honestly, there is no one blanket answer. It totally varies state to state and beyond even state to state, jurisdiction to jurisdiction, county to county. You know, some states have blanket policies on how they're expecting programs to pivot to providing services right now. I mean, honestly, this is where advocates have typically been incredibly nimble. I think programs have always been incredibly creative at managing survivor safety and their own expectations and their funding, because let's be honest, like most programs are funded with approximately $1. Although, you know, FIPSA funding is incredibly vital along with that entire network that programs are accessing. You know, this is something that advocates are dealing with all the time, not of course on a pandemic level, but in terms of leveraging creativity and leveraging resources to provide the best services. You know, that's happening all the time. So that's, you know, continuing to happen across the country. And I think that while everything is an absolute mess right now, something that has been, what I have seen as a positive is the increased attention to the needs of survivors. I think there have been so many news stories, you know, local news, national news, state news that have all talked about the unique issues that survivors are facing right now, which is very rare. And I think it's also shedding light on the fact that survivors have incredibly complex housing needs, economic needs, physical safety needs, court needs. And I think it's really forcing folks to grapple with all those realities. So that has been really positive. But I wish there was a blanket answer that I could give in terms of, you know, best practices and things like that, but it really varies. And in terms of safety planning, you know, there's a lot of great organizations and hotlines that can do those with folks. But in terms of court, just looping back to what Amanda mentioned, something that I did want to highlight is the Center on Court Innovation. I know this is a resource that will be sent to you later, but I can't help flag it, is doing a lot of work around educating attorneys in particular on navigating their own state shifts with this particular intersection in mind, with the needs of domestic violence survivors. And they're doing drop-in phone calls. So if you're working with an attorney that's working on this issue that has a particular question, that's a great place to go for some advice, some assistance, some resources.
Great, thank you. And I'm gonna jump in here with a quick answer to a question. There was someone asking what the acronym is that they keep hearing, the FIPSA. I'm guessing that's the acronym that's a question. That is the Family Violence Prevention Services Program Act, right? Prevention and Services Act, excuse me, Family Violence Prevention Services Act, and that's the funding that goes through the Administration for Children and Families for much of the family violence and domestic violence services programs across the country. All right, so I want to just loop back to one question somebody had about housing, and this is tied to this question that we're on, and that is, how is the pandemic affecting how individuals and families impacted by domestic violence interact with advocacy and safety net programs? And so it was about emergency housing, shelter housing. Samantha, you talked about this a little bit, but the question is about, what are the contingency plans that are in place to ensure safety of residents in those group settings in the context of the potential of the spread of COVID-19?
Yeah, so I mean, basically, housing is a mess, as it always is. But right now, like what we've been seeing is just there's been a lot of partnerships with hotels and motels in the areas where the shelters are, and they're trying to make sure that their funding stays, which is starting to dry up a little bit. We heard last week for some of the programs out there that it's starting to become harder to separate families. So, because I mean, most of the shelters here are not one family per room, and depending on how big the family is. And then if you have single survivors, male, female, transgender, whomever, they might be placed in a room with like 3 other singles. And so it's kind of tricky for them to figure out where to place people. Yeah, like that's really the best that we have right now for that. And they're doing a lot of disinfecting. They're doing screening as they come in. In some areas, law enforcement is doing the screening before they take them to a safe location, which has been really interesting to hear. That's in some of the smaller areas here in Arizona. They have a really great law enforcement agency that's there that will do screenings for them, so that the program doesn't have to worry about it themselves, taking temperatures and things like that, so that they can come into the program. And so that's just kind of what's been happening around here. Yeah. And as far as like, for me, the only thing that and I just wanted to bring this up just really quickly, like the only thing about the stimulus check that we've really been talking about is the fact that like survivors are having to, like landlords are, you can track when that money comes in, so to that, or who gets that money. And so we'll have a landlord that'll say, I saw that you got your stimulus package or your stimulus check on this date, where's my rent? And so that's one of the things that we've been hearing from some of the housing folks here in Arizona, and across the country. And that's a really disturbing thing that's been happening, to scare people around their housing. So just that they're being tracked by their landlord to pop up their stimulus checks so that they can stay there living in fear of that. So
thank you.
Yeah.
So we're going to transition to our next question, and there was a question that was posted online as well that feeds into this really nicely. And so that I'd like you to talk. And I'm going to, you can volunteer for who wants to go first. But so what can agencies and advocates do in the context of this kind of remote service delivery, the social distancing, to support survivors of domestic violence or those who are at risk of domestic violence? And this links to one of the questions, which was if any of the speakers are aware, and Amanda, you touched upon this when you said something about hoping to get judges on your webinar. So are you aware of communication or collaborative work with the judiciary to increased understanding of domestic violence during the pandemic, and what are the steps that are being taken, what maybe do you want to do? So it could be both what's in play currently, what you've got going, and then what maybe is aspirational.
Well, I think the more opportunities we have to include the judiciary, the better, right? Because of so much of what they do and the role that they play impacts the trajectory of individual lives and families. And so aspirational would be that this is actually the catalyst for our own ongoing efforts beyond the pandemic to include them, and having that be a regular topic of conversation and education, and hear from them what they need, right, to help them navigate those circumstances that come into the court specific to family violence. So we're early in the stages of trying to make that happen, but we're also going to be turning to our partner agency to help facilitate the communication and broad opportunity for them to participate, and hopefully have an opportunity to debrief with them afterwards about the content that was delivered and whether it was helpful, what was missing, what could we do better to serve them and the families they serve in their courts. And so for me, I would like for this to be that catalyst of change to reignite regular collaboration with them. Did I answer your question, Michael?
I think so, and I'm gonna come to the others. I want to stick with you just for a second though on the child support piece, because you mentioned something earlier about doing electronic signatures with DocuSign, so kind of which sounded like a way to reduce administrative burden, so you didn't have to get something notarized. Is that something that's been recently adopted there?
So whether it's regular forms that need to be signed, we're trying to do DocuSign. We're looking at e-CSRPs, doing things electronically for our child support. I can speak in acronyms all day, so forgive me as I try to say them all out, for our child support review process. And so knowing that there's a certain group for those establishment cases that may not be appropriate, but if it's like a modification or things like that, and we can do digital signatures, we will. And one thing I failed to mention through an electronic way means of what we're trying to achieve is hopefully getting through separate conversations as much of an agreed to order as possible when it's safe to do so, and kind of get everyone on the same page to where they're not having to be, in close proximity to each other by use of electronic means, and striving to really address those things on the front end so that we're not having to push so many folks further down our process through court proceedings or what have you. So I hope I answered your question.
No, thank you very much. So, and I'll, Samantha, Miriam, Rachel, if there are other thoughts you have on kind of the ways that you've seen some outreach work with the judiciary, any, anything happening on that in Arizona, Samantha?
Yeah, so no. Our judges have been pretty quiet. My boss sits on a committee of judges for the courts, and I asked her if they were meeting or talking or anything, and she told me no. So, which is unfortunate, but judges here are really reluctant to talk about domestic violence, and so I don't think that has changed. I'm hoping for the same as Amanda, that it's a catalyst. And Amanda, thank you, because you gave me a great idea to try to do. We do have one great judge that we work with in family court, and we're hoping maybe we can have a webinar with him talking about what that looks like right now. So thank you for the idea, I appreciate it. We've also been working on the DocuSign, so advocates have actually been working on that side of it as well. They've been having survivors, and I meant to bring this up earlier, they've been having survivors send in like, I'm gonna say an acronym now because I just forgot it. It's ROI.
Release of information.
Yeah, release of information. Thank you. I'm having a corona moment. Yeah, so they've been trying to get releases of information, and they've been having folks sign them and then take a picture and send it to their advocate so that they can use that releases of information to work with other advocates or other folks that are working on the same survivor's case. And so that's been really interesting to see that change happening within, not just for people that are doing policy work or people that are doing courtroom work, but also our advocates are able to use that that electronic form of signatures and things to get the best care that they can for their survivor right now.
Great, thanks.
Michael, this is Rachel. Can I jump in with
Sure.
a couple of things we're hearing on a national level? We are definitely hearing that there is a great need to be flexible in your delivery of these issues. I think in the first couple of weeks, we saw a lot of people and a lot of systems coming up with great ways to do everything virtually and through various Zoom type platforms. And then a couple of weeks after that, we started hearing that that wasn't necessarily working out great for survivors on the ground, because I think it's hard for those of us who work in an electronic context all the time to think about it, but some people don't have the technological skills, they don't have the computer at home, or they just don't have access to the broadband data requirements for these very data-heavy implementations. So if systems can be flexible in terms of allowing for phone-ins instead of necessarily video chats, that will make it more accessible to more people. Being understanding during hearings if a survivor has to drop out of the hearing and then come back in. What we were hearing is that some court systems have screening to make sure that only the parties are on the call. So then when someone drops off, it's very hard for them to quickly get back into the call on some of the platforms that are being used. So just thinking that, of course, a survivor who may be trying to use the local library's parking lot to do this call because they don't have broadband at home might have to drop off and come back on, and working that into how you expect your system to work is very important. And then also thinking about how you are ensuring language access, because translators are going to be even harder to work into your new process over the phone than it was in the courtroom, and making sure that everyone has the right people there to make sure that they can both advocate for themselves and understand all of what's going on in the court proceedings. Very important.
Thank you. That's a lot of important issues there for consideration. I appreciate that. You gave a great rundown on that. I'm curious. This is I think this maybe goes to the administrative burden section, but also thinking about are you doing anything different when it comes to screening and safety check-ins? So Amanda, I know that in Texas, that when your staff calls parents, at least parents who've identified family violence in the past, there's some kind of screening question about safety. Is it safe to talk now? Has there been anything done differently there? And then also, what about, thinking about the connection between receipt of public assistance, of TANF, and the child support cooperation requirements, and how that could be more difficult for a victim to navigate, especially, I think it's always difficult for a victim to navigate in the best of times. This is not the best of times. Has there been any adjustments made or considered there when it comes to cooperation requirements? So I guess it's a two-part question: screening, and then cooperation requirements. And Samantha, there may be something like that happening in Arizona too, and I'll come to you.
In Texas, there have been ongoing conversations with HHSC, so I'll get to that on the second part.
And who's HHSC? Who's HHSC?
Health and Human Services Commission. Thank you.
All right.
So we put forth recommendations, again, going back to what I said in the intro about not making presumptions about someone's circumstances when they engage with our system, whether their case is flagged or not. And especially since we rolled out a new tool during this pandemic to engage with customers through online chatting, is that we did put out some quick tips for our child support professionals, where we're recommending that, you know, as they follow any protocol, that they're establishing that the customer is who they say they are, and asking on the front ends, do they have any safety concerns, or are their devices being monitored? And that could be the same for our call center staff as well. And we encourage them to apply the same in-person safety and privacy protocols that they would if that person was present face-to-face. We also recommended that they only request information that they need to work on that individual's inquiry or case in that moment of time, and not to divulge, you know, a whole lot of information during that engagement, only what's necessary. But we also encourage that they check for the tone and the meaning and emotion, right, that may be communicated. It's much harder, in my opinion, and I'm sure of many others, to really sense tone. And so clarification is key in assisting our customers. And if there are any concerns that are brought up through those exchanges, we follow our normal protocol for family violence, where that would be documented within their case file. And so so all of that's being documented, because we also want to make sure that if there's even concerns, or maybe that person says, I don't want anything to be flagged on my case just yet, but do a note entry, right? So that if that customer is engaging another child support professional, there at least will be some form of reference, right? And if there's an opportunity to re-engage in that, safety protocols that they can. And so going back to your other question, with our partners at the Health and Human Services Commission, for good cause, where folks may be able to be exempt from participating as they're engaging through the public assistance arena, that we are having ongoing conversations with them about that. One thing that I can speak to that they did immediately was not require the face-to-face in-person contact for that requirement for the customer to engage face-to-face with a local shelter. And so they can do so over the phone, where before that was a face-to-face requirement. So immediately they rolled out that flexibility, which I'm sure everyone was very appreciative of. And then we have another meeting this week actually with them to see how they are moving along, and is there anything within our processes that's maybe getting in the way of us handling those as they should be, knowing that families need to either be exempt from those provisions or not. So as you can imagine, it's fluid, and you know, everyone has their resources kind of stretched right now, that we're doing all we can just to keep in constant communication. If we're not able to meet face to face with them right now, we are exchanging emails regularly. At this point, right now, there hasn't been any formal changes, but we are going to be evaluating, and we are actually reviewing a sample of visits. We just got some of those just to make sure that our processes aren't getting in the way of the customer.
Great, thank you. Samantha, anything in Arizona that changes there in terms of screening for public assistance or good cause that you're aware of, cooperation requirements being waived?
So I haven't heard anything so far about those things. I know that when we talked last week with DCSS, we encouraged them to keep doing the screening questionnaire about family violence, and to put the indicator on if they thought or was told that something was happening. I know for us, we really think that there should be a ton less restrictions around good cause. I know it's something that survivors are still talking to people about. So I'm hoping to see that there's an uptick in good cause cases that come through, because we just don't have that many. And so I would like to see some of those restrictions come down, but I would have to check with DCSS to see if that's happening yet.
And I'm going to turn this, Miriam, to you and to Rachel, and it's if you're hearing from any of the other organizations around the country where there has been some adaptation of child support cooperation requirements or other in the TANF program work requirements for survivors of domestic violence, and this gets to a question that was posed online, and I also heard in last week's NAWRS webinar on the TANF program, and that someone from the Vermont TANF program noted that because of the pandemic that they're treating all pregnancies as at risk, which means that pregnant women can automatically access economic support without having to obtain medical documentation. And so that was an example that in Vermont, a way of reducing an administrative hurdle from a parent getting economic support. So anything that you've heard in the child support or work cooperation requirements arena? Miriam or Rachel?
So honestly, I have not heard much about child support in particular and TANF. Again, I know that we've been providing a lot of individualized support on a state-to-state basis, depending on, whether that state, whether it's individual programs or whether the coalition has relationships with the agencies in the state. I feel like that has been the most successful in terms of getting agencies to understand the needs that survivors have, and then also do fantastic things like Vermont is doing, and some of those just happen more seamlessly in smaller areas or jurisdictions that already have those relationships. And I know, in terms of the national space, there are a lot of organizations that are trying to give guidance, that are trying to, push the legal systems, push the lawyers, push the judges, push the agency involved in a positive way. But of course, we know implementation is really challenging. So, there are some hurdles to be managed in that space.
I can't think of anything specific that I've heard to flexibilities around domestic violence, but I would say that every time we hear that there is a flexibility that is being broadly offered, either to another specific population or to all the clients of another benefits program, we certainly are glad to hear that, because we know that there are more survivors who are accessing other systems and services and depending on those than we maybe are, then you're going to see getting in your actual family violence option waiver numbers, right? So any time right now when there's a flexibility, we know that that's going to release some barriers that some of those survivors who aren't going to identify themselves would be otherwise facing to getting those. So I think it's always helpful to think about those other waivers and flexibilities in the domestic violence context as well.
And we just had chatted in the questions that the Wisconsin TANF program is treating all cases with flexibility around good cause during COVID. So there sounds like there's some a waiver of work requirements or flexibility around the work participation and child support cooperation requirements. So that's another example of from a state. Thanks for chatting that in. That was not one that we had heard about. So
I think so, Michael. Sorry, I just wanted to add that I think that this is thinking about the broader public benefits space. I think this is just a challenge that is being exacerbated, of course, by the pandemic. But I think it goes back to that initial relationship building that is often touted. I know I sound incredibly cheesy when I say it, and I know that domestic violence programs in particular and sexual assault programs don't always have the capacity at all to be engaging. And sometimes I think that also puts the onus on the agencies to be reaching out to their local programs and their coalitions to better serve, their clients, their constituents, and their populations. And I think that's where we've seen the most success, right? In terms of even housing systems, in terms of public benefit systems, when agencies understand these needs, a lot of the response is much more effective and responsive and creative.
Great, thank you. So before we move to our final kind of formal question, and I'm going to keep trying to manage the questions that are coming in, and I'm sorry. So if you've been wondering why I'm looking off to the side, I have a bigger screen that works better for my old eyes that I can look at to see the questions a little bit larger. This is a question that's related to this conversation that we're having about cooperation requirements and waivers, and this person has just said that, you know, in their state, that face-to-face assessment for waivers has been waived for TANF recipients, but in some cases it could be beneficial for the survivor to have to go in someplace or have a face-to-face because they're living with a batterer, and it gives them an opportunity to have a discussion in safety with somebody away from that batterer. And they're asking, are there, you know, do you have any suggestions, and I'll just open this up for all of you, on how to get in contact with clients and safely discuss DV situations when they live with an abuser, you know, in this time of remote service delivery? Come on, y'all.
This is Miriam. I just wanted to say, this is where some of the creativity has been really coming in terms of safety planning. You know, when we were talking about the housing context in particular, there was an advocate from a program in Iowa that's had a lot of success with hoteling that was talking about, you know, what those errands are that survivors might typically engage in. So if they're going for a grocery run, does that mean being able to make a quick call at the grocery store? You know, all of those, any kind of excuses, any creativity that can be applied. And honestly, a lot of advocates are amazing at doing this and thinking about little gaps that folks might have in their schedule or little areas and spaces. I see Samantha nodding about how to make that space even when it doesn't exist. And I think that is the most important thing. And I think if someone can do it with the support of an advocate, that's absolutely fantastic, because they're going to help think about a lot of safety considerations that folks may not have individually considered. But even if they're individually able to access a lot of these resources or pages, you know, they can help think through some of that as well in terms of, you know, figuring out how, where, and when to get the support they need.
Yeah, I agree. I mean, I think that it's just about being creative, and luckily advocates are so good at pivoting, and they're so nimble, and I mean, I find advocates that work in programs so extraordinary, because even just within the first 2 weeks of the phone calls that we were having, it was extraordinary to hear what they had already started doing. And it just goes to show how powerful we can be when we all come together and stuff. I mean, we made a flyer or a form. I have it sitting in front of me, that's why I keep looking off, about like things that you can do. So like some of the things that for like just looking at someone's, like when you're safety planning, looking at somebody's daily routine, like are they able to go to the laundromat? Like, do they live in a place where, and is that a safe place for them? Can they make a phone call there? Or going for a walk or walking the dog? Taking the children to the park if at all possible, going to the grocery store, going to the convenience store, exercising outdoors in some form or fashion, going to fill up the car with gas if they are able to do those things. Like, these are all ways that advocates have been trying to pivot to reach out to people to start that safety plan, even if it's just to get a break for 15 minutes from their abusive partner. It is, I mean, that self-care alone is so necessary for survivors and for victims living in a home with an abuser. And so like that's kind of what we've been working with people on how to get that creative outreach, but also like how to alleviate even just a little bit of stress from the survivor as they try to figure out what's going to happen, not just the next minute, 30 minutes, hour, days, but also what's going to happen, like what are their next steps when everything is open again, and what are they going to be, what do they need to figure out when that, like, is divorce still something that they want to do? If not, that's okay. How do we work with them so that they have a safety plan in place to stay in that home now that their perpetrator might be going back to work? So yeah, I agree with Miriam that it's just a lot of people pivoting and being nimble and trying to get the information as best they can in any means necessary to the survivors that they've been working with and new survivors that are coming forward with their story. I hope that answered the question.
I think it. I mean, I appreciate it very much.
I've also we've heard about a few programs where some of the essential local businesses have partnered with the domestic violence programs to create a safe space within, say, the pharmacy. So using a private room in the pharmacy for a survivor to be able to meet with an advocate there. So it would be a place where the survivor maybe had a reason to already go, and so I'm going to pick up prescriptions, but you also have a space where you could meet with someone or just have some alone time, like Samantha said. And I also want to just endorse that this is an amazing, the advocacy field is full of amazing people who are used to doing all of this flexible thinking and creative thinking, and that is just so useful in this pandemic. And one thing that we are thinking about on a federal level, and hoping that programs and coalitions will be thinking about, is how are we supporting this amazing creative thinking workforce, because they are dealing with all of the same pressures of this pandemic that the rest of us are, and not having childcare and stresses and health concerns. And we want to make sure that we come out on the end of this with still this amazing capacity, and that we're not losing any people because of shelter shutdowns in this field of wonderful advocates. So we're also focusing a lot of thought and hoping that people will support their local programs to make sure that we aren't losing that capacity.
And I'm glad that you mentioned that that point about the pharmacies, Rachel, because it made me think about, there's one state child support agency that I'm also aware of that reported back to me that they've kind of changed their standard phone protocol when they're calling a parent, and they're kind of just, they're offering kind of as a standard now. They just say, so we know during the pandemic, or I'm sure they say pandemic, during the the coronavirus precautions, that family safety issues have come up for people, and we have some resources we can tell you about, and I can, all you have to do is say yes or no if you'd like to hear that, and if you'd like to hear it, I can tell you about that information and offer some information with responses that you could just say yes or no to, so you wouldn't have to give me any personal information if it's okay for you to do that now, kind of. And just making those offers routinely, acknowledging that they know it's more intense and has become more difficult for survivors right now. So I think it's another one. Before we get to the final kind of question I planned to ask, there was a question that was chatted in about the connections between domestic violence and child abuse, and if there was any kind of specific tracking that anybody on the panel was aware of that was happening now, any extra connections that are being made, I don't know if anybody on the panel has the ability to speak to that or not.
Can I ask a clarifying question? Did I understand that, like, if there's tracking of whether the children are being abused during this time, like making the back
I think
to,
that's it. Yeah.
okay.
Yeah.
That's a good question. To my knowledge, I don't believe we're tracking it if it's directly a result of the pandemic.
I think anecdotally, we have seen that information, that folks are saying that they are seeing increases, and that there seems to be a natural, I think even before there were the official reports of the domestic violence incidents, of course, there was, of course, that same anecdotal evidence, right? That, like, people are stuck in the house with all of these additional added gazillion tensions that are often economic, financial, physical, lack of socialization, all of those things. So it's likely that this will have a negative impact in terms of increase of violence. So I think we're seeing some of the same things in terms of child abuse reporting. And it's something that I feel like some programs have mentioned as well. And there's a lot of, again, creative outreach to try to manage that. But I haven't seen any official reporting. I know there are a lot of fantastic organizations that are advocating for those needs to be discussed, acknowledged, and also focused on right now.
Okay, and we had one more chatted question that I didn't get clarified earlier, and that was thinking about victims who are in emergency shelters, and when they're screening for any symptoms, are there backup plans for housing folks who have symptoms that you're aware of? Is that something, I mean, Samantha, you may be the one that's got the most insight into that, at least in Arizona. Miriam, you may, and Rachel from the national perspective. Is that are local shelters coming up with, is that where the use of hotel rooms comes into play more often?
Yeah, I mean, I think so. We put out like a guideline to like at the very beginning, we put out a guideline to what folks what some of the precautions might be for the advocates, and it really is like the hotels and things like that. And then and if they do have someone that is in shelter, they will basically isolate that person to so that everyone is safe. So like whatever precautions are happening, so like even in my own home, like if I got it, my daughter, I would have to isolate myself from my daughter, and she would have to like feed me through the door or whatever. Like it's basically the same type of thing at the shelter if they have the capacity to do that at this time. That's as far as I know.
Yeah, so I think it's exactly what you mentioned, Michael, as well, with some of those creative options in terms of hoteling and moteling. I mentioned that website earlier, safehousingpartnerships.org. That's a collaboration of a variety of different agencies working on housing and homelessness and the connection between domestic violence. So we did do a webinar about this issue a couple weeks ago and post some resources and some tools that people can look at. And we should have some more guidance on what that hotel moteling looks like in terms of considering best practices up soon. And I think it's a lot of the same guidance that's also being used in the housing and homelessness field, because a lot of homelessness shelters are also communal, right? So they're grappling with a lot of the exact same concerns that shelters are, although of course survivors have unique and different needs. But there has been a lot of great guidance that's come out about how to manage and navigate all of those challenges and hurdles.
Thanks, thank you. So let's go to the final question slide, Asaf, if you would. And I'd like for each of you, each of the four panelists, to take this, and that is, and this will be a great way to kind of wrap us up. And so the question here is what are the changes that you're seeing being made in your programs, policy, procedural, administrative barriers being reduced? What are the changes that you see being made that you see value in sustaining, right? And Amanda, you kind of alluded to this a little bit, but I'd like for all of you to talk about your response to this question. And on my screen, Samantha, you're first, so I'm going to just ask Samantha to go first.
All right, so the first thing that comes to mind when I think of this is the support groups that I talked about earlier. We've had people come to some of the support groups from other states, which has been phenomenal for the programs that have been doing it. We're also, I know that a program is starting to work on they're starting a program for parents with children that have been abused during this time, and how to work with your children like during this time for parents that have that their children have experienced child abuse, which is fascinating. And so I think what's going to really be sustained, everyone seems to really be on board with the support groups, or having a way to talk to their survivor virtually if possible, so that I think what will happen is that we'll have a mixture of both happening. So we'll have an in-person at a program, and then we'll have a virtual support group as well, so that it can feed more people across the nation. And so it's just been really interesting. We're not quite sure how people from across the nation have already figured out to come to some of the support groups here in Arizona, but that's pretty spectacular to me. And that it just goes to show how resourceful advocates are, and that they can speak to many different things in those support groups, and how necessary and needed they are right now for people, if it's at all possible for them to reach out and be part of that. And so I think that's probably the biggest thing right now. I think that probably some of the restrictions that have been so focused on helping survivors, I'm hopeful that those will kind of stay in place, and that we realize that we don't need so many restrictions when we want to help a survivor on a either whether through the court or advocacy or through child support or even child protective services, that some of those things can, like maybe easing some of the waits for someone to get some aid if they need it or anything like that, and housing aid or any of that, and so that some of these things that we've already put into policy during this time can stay in place, knowing that survivors don't necessarily need all of this, all of these things to go through before they get the aid that they need to stay safe. So I hope that makes sense, but yeah, that's what I'm hoping.
So that's some of that easing of administrative barriers, right? Yeah.
Yeah.
Things of that. Okay, Amanda.
So much, right? I hope to see be sustainable out of this process. Mostly so, a lot of what Samantha expressed, I also echo about easing those administrative burdens. I often say that having worked in state government since I was 18 and knowing quite a bit about it, and I still so much I don't know, that I often empathize with our customers and sympathize with them about if I were in their shoes and I've got to access multiple systems in order to just provide for myself and my family, and how overwhelming it is as an experienced state agency administrator, what that must feel like for them. And so using this as that kind of reminder to make sure that we are not overburdening our customers through our processes. So I think that's going to be kind of like my moral code through this and beyond. But beyond that, I'm hoping that some of these technology tools that we're implementing, that as long as we're keeping our customers safe, that it could be kind of a model in which we can use with more options for them, right? Going in person to our offices may not be safe, but it may be safe for them to engage with us virtually. And what that may also mean for our rural areas in Texas, and how we're able to be more available to those families. But also using this conversation helped center me and to focus on what are the data elements, right? And us maybe being a little more proactive about the data that we want, and having that help inform the way that we go moving forward. And hopefully our opportunity to be more inclusive with the judiciary and what they may need, and that being more of a mutual engagement. They're great, right? They're really great with us, so I don't want y'all to think that they're not, but I think that this definitely highlights an opportunity for us to maybe broaden our conversations and see what they may need from us, and vice versa.
Thanks, Amanda. Miriam?
Sure. I think for me, I would just hope to really see the flexibility that's been given to programs, it's given to survivors, it's been given to agencies continue. I think everyone is realizing during this pandemic that every individual human, that of course means all survivors and their families, have very unique and individual needs. And I think that people are really thinking about that right now and going out of their way to be creative in terms of provision of services. So I would just love for folks to continue that beyond the pandemic, because that has been consistent before and after. And I think Samantha and Amanda both talked on that, with the burdens that a lot of, rigid requirements bring, and that survivors cannot always face or manage, and that's really exacerbated during a pandemic. So I would just love to see all of that continue beyond this.
Thanks. And Rachel?
I'll echo Amanda and Miriam on the flexibilities, expanding the accessibility of services to everyone. I hope that when we come back from this and we can do the old ways of doing things, we have this expanded menu that really helps us meet the needs of people with disabilities and rural populations and people who maybe we haven't had the best access to in the past. And then additionally, I think that these partnerships that we have seen people figure out how to make between agencies, between private-public partnerships, all the people sort of coming together and figuring out how to handle this novel situation, I hope that those partnerships will be able to sustain into our return to normalcy and really strengthen us in the future.
Yeah, I really like that point that there have been partnerships that have been forged out of this the crisis, and we don't want to lose those once we've passed through at least what is the hottest part of this crisis. We don't want to lose those partnerships. We want to maintain those. So thank you. Well, I want to extend my thanks to all four of you. It's been fun for me to see your faces as you've been talking. I've loved the points that you've raised, highlighting the fact that we're in the midst of this and there's a lot of fluidity and we're learning from each other. And I appreciate your time. And I know that Miriam, you've sent a bunch of resources that are going to be posted on the follow-up of this. And I guess, Asaf, I'm going to look back to you. Are there any follow-up kind of housekeeping things you need to do as we wrap up today's webinar?
Yeah, just a couple of quick things. I mean, really, again, extending our appreciation to all five of you for what was really a very informative conversation. I think it's sort of very interactive amongst the panelists and the folks on the line. And so I thank you all. As Michael said, we're going to work our best to share some of the resources Miriam and others have that hopefully are applicable in real time to the folks out in the field doing this work. Those will likely be posted on the NAWRS website, nawrs.org. In addition, as I noted at the outset, this is being recorded, and so as soon as we get that posting up, we'll notify registrants as well. One final pitch: if these are the types of conversations you enjoy, NAWRS does a lot of this type of work, and we're always trying to find new and creative ways to engage the research policy and practitioner communities. So feel free to be in touch with myself or any of the folks on the NAWRS board if you want to get involved. But just maybe to conclude, thank you all again, both for attending and obviously for our panelists and moderator for your time. Have a great day.
Thank you.
Thank you.
Thank you.
Thank you.